Good morning. Today's topic is fixed partial denture. Good morning. Today's topic is about fixed partial denture. What is fixed prosthodontics? Fixed prosthodontics is a branch of prosthodontics which deals with replacement of missing tooth or restoration of a grossly damaged tooth. Okay, so in this, again, fixed partial denture. It is a dental process that is luted, screwed, or mechanically attached, or otherwise securely retained to natural teeth, tooth roots. So it involves not only the replacement of a crown. Here we get support even from implants. So in any way, however we are going to replace a missing tooth, or we are going to restore a tooth to function. That is fixed partial denture. So what are the different ways of restoring tooth? We can give a crown for a grossly decayed tooth which is root canal treated, or any other ways, inlays, onlays, laminate, veneers, as well as single bridge replacing missing tooth. So what are the indications and contraindications? So indications, if it is going to be a short span edentulous arch, if the arch is very short, the missing tooth is very less, then we can go for a fixed partial denture. And the adjacent abutment tooth, which are going to be supporting the fixed partial denture, should be of sound tooth structure. Next is a patient's preference, and as well as in a mentally compromised patients, we can go for fixed partial denture. What are the contraindications? Young patients, very young patients, the pulp chamber will be very huge. So in that case, we will not be able to do a crown. So in that case, we can't go for a fixed partial denture. In periodontically compromised abutments, long span edentulous arches. So if the edentulous area is very large when it is compared to the supporting tooth, bilateral edentulous spaces, congenitally malformed teeth. So these are the situations in which we will not be able to do a fixed partial denture. So what are the parts of a fixed partial denture? So today we'll be seeing in detail about what are different parts in a fixed partial denture and what are in details. Okay. So when we see about fixed partial denture, it consists of mainly three parts: the retainer, connector, and pontic. So the retainer will be sitting on the abutment tooth. So abutment tooth is which is going to support the fixed partial denture. So first we'll see about retainer. Retainer is nothing but a full veneer or partial veneer crowns. So the retainer will be covering the abutment tooth if it is going to be a fixed partial denture. If it is going to be a single crown, it will be covering that particular tooth. So there are different types of retainers depending on the materials used: all ceramic, porcelain fused to gold crown, porcelain fused to metallic crown. These are the classification of retainer depending on the material. Depending on minimal preparation veneer, again, so only a limited portion, that is the labial surface of the tooth, will be prepared, and then we place a veneer. The other third type of retainer is fiber reinforced composite. Here nothing but the abutment tooth will be supported with a fiber network. Then on top of that, the composite will be added, and you just see the third picture, you will be able to see the tooth will be built up so that the restored tooth can be the missing tooth can be supported or recreated. Next is the pondix. So again, this is the where the tooth is being missing, or the edentulous area where we are going to replace the tooth is known as the pondic. So what are the ideal requirements? So it should be giving good aesthetics, it should restore the function, it should be comfortable to the patient, and the material should be of a biocompatible material, and it should preserve. So any pondic we are giving, it should preserve the mucosa and the bone which is underlying. So what are the types of pondics? So it is again divided into two types, with mucosal contact and without mucosal contact. So with mucosal contact, you can see there are different types. So in this, with mucosal contact means the pondic will be in contact with the mucosa. So here you can see the pictures, saddle pondic, ridge lap pondic. So these are the different types of pondics with mucosal contact. Next is without mucosal contact. Here the pondic will not touch the mucosa. It will be away from the mucosa. So there are certain situations in which we give without contact, mucosal contact pondics. So these are sanitary or hygienic pondic. As the term specifies, sanitary or hygienic. So here the hygienic of the area can be preserved. So when there is space, the patient can brush, or if any foodstuff gets inside the pondic area, it can be brushed or it can be washed out. Again, modified sanitary or fish bell. So this again, the same sanitary, it is being little modified so that the contact area, the space is more, so that nothing will get into that space. So whatever get into foodstuff get into that space, it will be washed away. So next is the third part of the fixed partial denture is the connector. So again, this connector is the part which is going to connect the retainer and the pondic. That is, the retainer means which is going to cover the abutment tooth, and the pondic is the tooth which is going to replace the missing tooth. So these two will be connected with the connector, as the term implies. So there again, so this connector should be strong enough. So whenever the patient chews with the fixed partial denture, this is the area which is going to flex. So this area should be strong. So if it is going to be strong, then when the patient chews, that will not damage, it will not cause any damage to the abutment teeth or to the fixed partial denture. Again, there are different types in that, a rigid connector and non-rigid connector. So according to the rigidity, as the term tells you, rigid connector. So there again, in rigid connector, there are three types: casted, soldered, and loop. So as you see the picture, you will be able to see the connector where it lies. So this connector is going to connect the pondic and the retainer. So this area should be rigid enough. So casted and soldered are again, casted means the entire unit will be casted directly. Soldered means first the crown, the retainer and the pondic will be made, and then it will be soldered or it will be connected. The loop connectors are when you see the lower picture, you will be see loop connector. Loop connectors are mainly used with patients who are going to have midline diastema. In midline diastema patients, so most of them, some patients will ask to close the space. Some patients they will ask, no, the midline diastema should be maintained. In that case, we can give a loop connector. Again, these are the different types of rigid connector. Next is the non-rigid connector. Non-rigid connector means the connector area, the area in between the retainer and the pondic will be of non-rigid. It will not be rigid. So some amount of flexion will be happening so that the abutment tooth will be safeguarded. There are different types: split pondic, cross wing connector, and dovetail. So when you see the split pondic, just see the picture. So here split pondic. So the pondic will be splitted into two. First, the one portion of the So this type of split pondix will be given mainly in the case of a fire abutment tooth. That means if there is going to be two abutment tooth and in the center of the edentulous area, if there is going to be one tooth, so that is known as fire abutment. So it is going to be an extra abutment in the center of the edentulous area. So in that case, what is the reason for giving a split pondix is, so when you are giving a long span bridge, if there is going to be a fire abutment, if you are not going to give a non-rigid connector, the more force will be acting on the fire abutment. So what will happen is the fire abutment will lose its function. So in these cases, we will be giving split pondix. So the pondix will be splitted into two. So the first half of the bridge will be cemented. Just see the picture. And the next half, again, there is a pin like something which is coming from the pondix. So on top of that, the other portion will be cemented. This is known as split pondix. Next is the cross pin and wing connector. Again, here also, when it is going to be mainly this type of cross pin and wing connectors will be given in a tilted molar tooth. Okay, when the abutment tooth are being tilted, this type of connectors will be given. So here, there will be a projection which comes from the wing-like projection which comes from the tilted abutment tooth or the retainer. Then the other portion of the abutment tooth will be having a covering which will cover the wing, and finally there's a hole in between which will be connected with a pin. The main advantage of using non-rigid connectors is we will be able to repair. If there is going to be any problem in the process, we'll be able to take the two units separately. But when it comes for a rigid connector, we will not be able to do that. And if you see the cost of, if you see the expenditure, it will be more, and the work has to be very precise. That is the disadvantage of using a non-rigid connector. Next, last one is the dovetail connector. Here again, there are two parts, a male part and a female part. So each part, the male part will be fixed in a retainer and the female part will be fixed in a pondix. So in that case, we will be able to, the male part and the female part will be sliding into it so that we will be able to cement the processes. So these are the different types of the parts of a fixed partial denture. And with that, we come to the conclusion of this topic. Thank you.